preschool scenario. An overview of our presentation, it will consist of an introduction of our group and all of the members. We will go over our ABA guideline on functional communication training. We specifically chose to implement the Picture Exchange Communication System, or PECS, so we will be discussing that. We will then move forward to talk about trainings, school-wide positive behavior support plan, and our references. My name is Oceana McWay.
I'm Caitlin Doyle.
I'm Sarah Glenn.
I'm Caitlin Barron.
I'm Krista Stapleton.
So our scenario was the Ellison preschool scenario, and it is as follows. Ellison is an inclusive preschool in an urban area. It serves 200 students, 50 regular education, and 150 special education, 3 to 5 years old. Approximately 50 of the preschoolers receive speech therapy. Half of the 50 preschool students who receive speech therapy are nonverbal, and 5 of them use PECS. The remaining 20 nonverbal students occasionally point or grunt, but are not using any other communication methods. Ellison has 20 classrooms with 8 to 12 students in each, along with a teacher and 2 assistants. There are also 2 full-time speech therapists, 1 occupational therapist, and 1 physical therapist. The school staff also includes a principal and a BCBA. In addition to the school staff, 4 to 6 volunteers are available daily from the Parent Volunteer Program. Primarily, the volunteers support staff by taking students to the bathroom and making copies for teachers. There are 2 ongoing behavioral issues during playtime in every classroom, which continue to be fights over toys and tantrums. In most cases, the problem occurs when a student grabs a toy from another student rather than asking for it or asking to play with them. Often this results in students fighting and 1 or more students throwing a tantrum.
So next, I will be going over functional communication training. It's common with autism spectrum disorder to have highly physically aggressive behaviors, including tantrums, aggression, self-injury. There's also behaviors like repetitive behaviors, noncompliance, and functional communication training, or FCT, has been proven to help decrease some of that problem behavior. According to Prelock and Macaulay, FCT involves replacing an identified behavior with a more appropriate alternative behavior. They outlined a few different steps when implementing FCT. The first step is to identify the problem behavior, and that includes defining that behavior clearly so everybody involved understands exactly what behavior you're talking about and what it looks like. And then the next step would be to assess the function of that behavior, which is why it is occurring. You could do different assessments to be able to address that function. And once you have determined the function, you can identify a more appropriate alternative behavior you want the child to start using. And then lastly, you'll want to teach that alternative behavior. And typically you'll start with very intrusive prompts and then fade prompts as soon as you can and when that's appropriate. And it's important with that alternative behavior to match the function of whatever that challenging behavior is, so it will be effective to replace that problem behavior. Strasburger and Ferrari did a study about peer-assisted communication on nonverbal or kids with limited verbal skills with autism spectrum disorder. They used both neurotypical peers and kids with autism, and they trained using a peer-assisted communication application, and they utilized neurotypical peers to be the ones that are accepting that mode of communication to encourage quick responses and to reinforce the use of that communication training. It was found to be very effective in increasing those communications between peers. Independent mands increased for requesting items or activities. If they did independently manned, they would receive that item immediately, but if they did not, they would go in with a physical prompt to emit the correct response. All participants in that study showed an increase in the frequency of manding during and after the intervention phase. Some people and some facilities also use augmentative and alternative communication strategies that can be AAC devices or PECs. And the use of AAC devices have been shown to help overcome the barrier of misunderstanding spoken communication or assist with increasing communication between peers and to increase communication of the client's wants or needs in a functional way.
Steps to implementation of PECs. Phase 1, exchange introduction. 3 participants, learner, communicative partner, which is a teacher or a parent, and a facilitator. The learner is the message sender, the communicative partner is the message receiver, and the facilitator provides physical assistance to the learner. A desired item is shown to the learner reaches for the item, but is redirected by the facilitator to a picture of the item. The facilitator physically assists the learner in picking up and handing the picture to the communicative partner, and the partner exchanges the picture for the preferred item. The partner must be in close proximity for a quick and easy exchange, and no words are used until the picture of the desired item is presented, and then the phrase "you would like" is used prior to the exchange. Assorted items and role changes between the facilitator and communicative partner should occur with a goal of at least 80 exchanges per day. In phase 2, the independent exchanges begin to occur. Independent attempts are increased, and the assistant still remains available if needed. The learner begins to remove pictures from the board or the book on his or her own and engages in more physical movement during the exchange than in phase 1. Learner also begins to carry his or her textbook on own. In phase 3, the selection of target pictures from multiple pictures occurs. The learner is taught to accurately select the desired picture from various representations. Error correction strategies are used when an incorrect selection occurs. In phase 4, we introduce the sentence strip. The learner is taught to use picture phrases such as "I want" in conjunction with the desired picture on a sentence strip. The learner then exchanges the entire sentence strip for the desired item. In phase 5, the introduction of response to prompting. The learner is taught to respond to the question, "What do you want?" by exchanging the sentence strip. The exchange behavior should be automatic by this phase. And in phase 6, we introduce the commenting behavior. The learner is taught to comment when prompted by questions such as "What do you see?" or "What do you want?"
Some of the materials that are important to have when using the PECS system are preferred items and reinforcers, so items that the client is really reinforced by and wants to work hard for. A PECS manual to guide you step by step and answer any questions you may have about how to use PECS, and it also includes data sheets on how to track each training phase of PECS. A communication binder per student, so they have their own pictures and modes of communication that they can keep on them. A method for acquiring pictures, whether it's from some kind of PECS materials that you can buy, or whether it's from just printing them off the computer or taking pictures of the actual object or area. It's also important to have cardstock or some sturdy paper to print the pictures on if you are printing them. And then scissors for cutting out the pictures, and then to also make them more sturdy, it's suggested that you use a laminator and laminate the individual pictures. You also need Velcro or magnets to hold the pictures onto the board and to secure them so the client can use them. For how to determine success with PECS, it would be mastery of each phase. They wouldn't move on to the next phase until they have mastery of the previous one. Frequency of manding should go up. correspondence checks, initiating and responding should both increase. And the skills should be generalized across settings and different people and time. And these skills should also be maintained over time. So for training, what we determined would be a good training setup would be a professional would be responsible for implementing PECS and will be presented with a PECS manual, which includes all the phases, the data sheets. Along with the PECS training manual, teachers will attend in-school training workshops where they can advance their knowledge of the PECS system, and they will be trained on each individual phase at one time. So first they will be trained on the first phase, and they will go through mock scenarios. They will create an example of a PECS board and go through kind of some troubleshooting there. And then once they have a client, one of the kids moves up to phase 2, then the second training will begin. They'll also discuss strategies to ensure that the receiver of the pictures responds appropriately and immediately to encourage that exchange. They'll discuss in that training multiple reinforcers to have readily available for each client. And then they will be walked through the phases in each training. There'll be additional trainings for each phase, and then there'll also be follow-up trainings to ensure maintenance of the skills and making sure that to increase fidelity of each phase, there'll be checks, and the trainers will come back and observe the implementation of the PECS system. The individuals, the teachers, and the principal and the BCBA will all have access to everyone's email to be able to shoot out emails with questions and receive prompt responses on any troubles they may be having implementing PECS. Next will be a video of what PECS looks like, what the board looks like, and the first phase of the intervention for PECS.
Have ready is something that your learner wants. We call this a reinforcer. Like candy. It is ideal to have at least 3 reinforcers before you begin. You can identify reinforcers by eliciting or observing 3 different behavior patterns. Look for items they exert effort to gain access to. Look for items they resist having taken away. Look for items they spend a lot of time with. These can be toys from around your home or school, food items, or anything they like. The second thing you need to do is prepare corresponding picture symbols. The Pics for PECS CD or PECS 151 picture set can make this easier for you. You need to find a symbol that represents the item, and then give the picture a label so that everyone on your team names it consistently. You then need to ensure that the symbols are tough enough to last. It is a good idea to laminate them. Next, you need to apply hook and loop fastener to the symbol. We always apply the loop fastener, which is the soft side, to the symbol, and then the hook fastener, which is the hard side, to the book. Now you are ready to get started. Here are a few pointers to help you. Here is a PECS prompter to assist in teaching the first phase of PECS.
Chocolate. Robot. There you go.
We wish you the best, and remember, we are here to support you in helping your learners to achieve their full potential.
So when considering PECS as a school-wide positive behavior support, we have come to the conclusion that this will categorize as primary prevention, otherwise known as Tier 1. This entails the intervention targeting both students and staff because it will change the behavior of the students by allowing a functional communication system, allowing students to ask for toys and items, and they can emit sharing between multiple learners. This will also change the staff's behavior by continuing to do those correspondence checks and biannual trainings. The school's BCBA will be responsible for the general implementation of PECS as far as providing materials to teachers and beginning training with them. The school principal will also be a part of the general implementation, but the majority of the responsibility will fall on the BCBA since they are most likely to be more qualified to implement the PECS system. And then for professional development and funding, we already spoke about our training. So we will be doing biannual training for teachers at the beginning of every semester just to ensure that they are continuing to implement the intervention with fidelity. And we want to ensure that the skill is being maintained not only in our students, but our teachers as well. Another way that we'd like to reinforce our teachers for implementing this school-wide positive behavior support is to introduce staff competencies. This will be take place in the variety of a monthly observation where the trainer will observe the teacher and observe the implementation of PECS, and then they will score the teacher based on the fidelity of which the implementation is running. And this will result in bonuses for the teachers. So that should be reinforcing for them to make sure that they are running that with fidelity. And then lastly, this program will be implemented using grants since Ellison Preschool does have 20 classrooms and a lot of nonverbal learners, 50 in fact, so it will require outside funding to be able to provide materials for every student in every class.
So PECS and how it will help. PECS, as you know, stands for Picture Exchange Communication System, and this will be used to help with the communication for the nonverbal individuals. For the Ellison students, this will help increase communication for all students, for them to increase their communication for their wants and their feelings. This will help in decreasing fights and tantrums over toys, and also as well increase the socialization of nonverbal children with the verbal children in the classrooms. Strategies for personalization and policies that will be used. So the school, Ellison, will have a leadership team that will be the BCBA, the principal, the trainer, and one head teacher. These individuals will get a special training on PECS and know exactly how to use it and be able to train other individuals and the rest of the staff at the school. The leadership team will have jobs of developing a plan for implementation, training the staff, making sure there is treatment fidelity, as well as giving feedback to the staff and going over the competencies each month, and some policies that will be included and added to Ellison's policies are the budget, the responsibilities of the leader team, and what were to happen if failure to implement PECS for staff would happen. So parental involvement and volunteers in the community will be highly encouraged. Parent training will help with generalization of the PECS skills not only in school, but as well as in the home setting. And with these generalizations, it will be a hope that the children will go through the phases quicker because they will be using those skills more often. And with the community volunteers being invited to the training, this will also help the children to generalize their skills with different people across different settings.
Okay, again, to talk about the setting. The setting is a preschool that is located in an urban area. The preschool has 200 students. 50 of them are regular education, and then the other 150 are enrolled in the special education. The students range from 3 to 5 years old, and there's 20 classrooms. Each classroom contains 8 to 12 children. We need the PECs for this preschool because there are at least 2 ongoing behavioral issues during playtime in each classroom. And there are 50 preschool students who are nonverbal. The PEC system can help the nonverbal students express their needs appropriately. The team of professionals would include the teacher, the main teacher, the aides in the classroom, parent volunteers, and also BCBA in every school. Every professional will implement the use of PECs in the classroom so that the problem behavior can decrease. If every professional is following the same intervention, it will be more effective for the children. The cost of effectively introducing the PEC system would cost $399 for all the professionals involved. The program is through Pyramid Education Consultants. All professionals in the school would have to attend a workshop where they would teach the different levels of PECS training. Also provided at the workshops would be materials for each classroom that they can purchase. A large communication book for each classroom would be purchased at $36. Pictures used for PECs can be bought at the workshop for $59, and that consists of 3,200 images. When a new staff is added, it will be mandatory to get the PECs training done also. A workshop can be held every year for new incoming staffs. The facilitators and barriers for the PEC system would be that the PEC system would be more effective for students if parents, speech therapists, occupational therapists, and other members outside the classroom would incorporate the PEC system with the individuals as well. The barriers would include if members outside of the classroom are using other interventions other than PECs, could be very complicated for the child to grasp, which would not be making the PECs as successful. There is a need for change in the classrooms because of the ongoing problem behavior that is occurring. The problem behavior of tantruming is an everyday issue in the classrooms and is distracting students from their chances to learn. The problem behavior is also encouraging other students in the class to perform the same way. Utilizing the PEC system will make sure that all students who are verbal or nonverbal are following the same pattern and way of communicating appropriately to reduce the problem behavior.